Hello and welcome to Cyber Focus, your source for international business information. My name is Sarah Koh, and our guest today is Dr. Robert Reiner Jr. Now, Dr. Reiner is an assistant professor of epidemiology and biostatistics here at Indiana University School of Public Health. He's also a research associate at the Research and Policy in Disease Dynamics program. Dr. Reiner's research focuses on the role and drivers of how various infectious diseases are spread and transmitted. Now, his latest studies include the disease ecology of the mosquito-borne pathogens and viruses, as well as development of novel modeling frameworks to methodologically assess these epidemics. Now, we have started off 2016 with a dangerous health hazard called the Zika virus. While experts trace the first documented outbreak to be in Africa, the virus has now become an international worry as more than 20 countries report having patients suffering from this disease. Now today, Dr. Reiner will tell us what exactly the Zika virus is and how it's affecting our global community. Dr. Reiner, thank you so much for joining us today.
Thank you for having me, sir.
So could you give us a quick outline of what exactly is the Zika virus and how dangerous is it?
Sure. So Zika virus is one of a class of viruses called flaviviruses that are almost exclusively transmitted by Aedes mosquitoes. The Aedes aegypti and Aedes albopictus are the primary vectors of it, as well as other viruses like dengue, West Nile virus. We also have other viruses transmitted by the same mosquitoes, chikungunya. So they're all in the same kind of class of arboviruses. And given wherever the distribution of the mosquitoes are, if there's enough people and the pathogen gets introduced, it can then propagate.
So do you think the Zika virus should be considered, I mentioned a little bit in the intro, but do you think it should be considered as a major global concern, and if so, why?
So again, a lot of it has to do with the distribution of the mosquitoes that transmit it. And the mosquitoes that transmit it are globally distributed, mostly in temperate zones, not just tropical zones, but also temperate zones like Southern Europe and Southern America, Southern US. But as far as it becoming a global problem this year, it's probably a little bit early to say that it's actually going to spread throughout the entire world and become a huge problem. There are other pathogens, again, like I mentioned, dengue and chikungunya, that haven't spread as much as maybe the map could say they could, given where the mosquitoes are, but there's still a huge problem for a large amount of the population of the world. But we're not going to be getting ongoing Zika outbreaks here in Indiana, for example.
Well, tell us a little bit about your research. I highlighted it when I was introducing you. Do you think some of your research might have some helpful correlation or shed some insight on the Zika virus as well?
Sure. So some of the research we do is trying to understand the really fine-scale drivers of transmission patterns. So, for example, why there'll be an outbreak in one house or one neighborhood and there wouldn't necessarily in the very next neighborhood in the same city. Some of it has to do with how pathogen can move from one city to the next. Some of the more relevant stuff, perhaps for Zika, is concerned with the population dynamics of the mosquito. Again, it just comes back to a lot of understanding of the transmission patterns of these mosquito-borne pathogens has to do with the mosquito, how long the mosquito is somewhere, how well the mosquito is able to survive. So in a place, again, like Indiana, we actually have the mosquitoes that transmit Zika. We only have them during the summers, but we have them. So we have Aedes albopictus. Its range has increased over the last 20, 30 years to include DC, much of the southern U.S., not quite over to California, but then Aedes aegypti has actually gone into places like California. They're both in Houston, they're both in Florida. And so understanding how the mosquito propagates how the mosquito's population is able to maintain itself and how long it's able to maintain itself. For example, here it's only a couple months, meaning it's probably not going to be able to, the pathogen won't be able to take hold. And we wouldn't be able to have a large outbreak because by the time the outbreak gets going, all the mosquitoes are going to die off. Whereas in other places in the country or the world, if the mosquitoes are there for longer, we can then predict there's going to be a bigger outbreak depending on when a hypothetical invasion would start.
That's a very interesting insight you just gave us there. So, economically speaking, just for an example, the dengue epidemic that you are really involved in and studying and researching, it actually reports say that, I have the numbers here, that it cost the world about $9 billion, more or less along that line. So it obviously is not cheap on the global economy. Now, in your opinion, do you think the Zika virus and trying to control that and assuage that problem will parallel that of dengue, economically speaking?
So a lot of the burden of dengue, dengue is actually 4 related viruses that are all antigenically distinct, but they all fall into the same class of virus insofar as if you have one of them, you get a related immune response when you get affected by another one. Because there's 4 of them, you can get it 4 times. And so the burden, as far as economic burden, is going to be both in terms of, well, obviously controlling it, but also there's an economic cost when someone gets sick and they're unable to go to work for 6 to 9 months. There's obviously an economic cost when somebody dies. As far as dengue, currently around half the world's population lives under risk of dengue, and there's 50 to 100,000 infections a year. Because of that, that's going to be a huge burden. Zika, again, should be able to have the same theoretical impact were it to have spread as far as dengue. But given that it hasn't spread as far, at the moment I would be very shocked if it had that economic impact. Over the life course of Zika, until we're able to do something about it, on the other hand, I could imagine it having the same sort of numbers of people infected, numbers of people affected as well.
Now, finally, currently there is no cure for Zika virus. Am I correct? Okay. Well, in your opinion, what do you think both the public and private sectors could do? I mean, what kind of initiatives or maybe what kind of steps they could take in order to help contribute to finding a cure or to, I guess, delay or decrease this epidemic worldwide right now?
So, like a lot of other flaviviruses, there's effort going into developing vaccines. Vaccine development, of course, is an extremely costly thing. It takes many years just to develop a vaccine, and then it takes a decade or so to actually test that vaccine enough to be able to then license it. The dengue vaccine has just been licensed, but it's actually not as successful as I think people would hope. Again, dengue is a little bit more complicated given that it's the 4 viruses. But Zika virus is actually getting fast track right now at the NIH and the CDC to try to develop a vaccine that again will take about 10 years to go through the trial process of being tested on a small number of people and then tested for more long-term impacts. Really, the only thing we have, therefore, is to do something about the mosquito, because we can't really do something about the pathogen. There's a couple of different options. So first of all, we can do control efforts. Control efforts are, going as far from simple things like removing water sources in and around a person's home to large-scale spraying to, international efforts to eradicate a mosquito. But then there's also additional efforts being done in different places where people are trying to have genetically modified mosquitoes that either can't themselves procreate or have been infected with something else that's then able to be passed down from mother to daughter, because the women are the female mosquitoes are the only ones that bite. They have something infecting them that's passed down from mother to daughter that makes it so that even if they take a blood meal from an infectious person, they themselves don't become infectious. Those are both options that are also being actively tried. But as far as what a person can do, basically just trying to avoid mosquitoes by either wearing something that's have a mosquito repellent on it, removing larval sources, kind of the simple everything you can do for any mosquito.
Oh, thank you so much for coming in to speak with us and sharing with us your insights.
Thank you.
Well, that's it for this edition of Cyber Focus. Thank you so much for tuning in. Now, if you have any questions or concerns or even suggestions for future topics, please let us know at CIBER, that's CIBER, @indiana.edu.